You know, we see a lot of different deformities in podiatric medicine, but probably two of the most frequent problems that we see are bunions and hammertoes. So I want to take a little time, to tell you a little bit about it. A bunion is that knot that you see on the side of your big toe. Your big toe may start to deviate away from your body, depending on the type of shoes you wear. In fact, there are some shoes that you won't be able to wear because they become so painful. I think that these are very, very common, especially I see them in my female patients who wear a lot of dress shoes, because what happens is they're squeezing their forefoot into a shoe that's just really not made to fit the anatomy of their foot. But we do see them in all patients as well. What happens with a bunion deformity is we do try and recommend conservative things, such as wider shoes and possibly orthotics, which are custom molded insoles that go into your shoes, sometimes anti-inflammatory medications, but ultimately this is a bony deformity and does require some type of surgical treatment to correct this deformity. I will tell you that my patients, when this is done, they say, I can't believe I waited so long to take care of this. I've suffered for so many years. I wish I would have done it sooner. And it's a nice feeling to hear that, because I think that patients have heard rumors and stories about what it was like to have something fixed. And technology has changed so much in medicine that most of these surgical procedures are now done as an outpatient procedure where you're actually walking the same day these procedures are done. That doesn't mean you're going to be going into shoes, doesn't mean you're going to be doing the laundry, doesn't mean you're going to be going shopping, but it does mean that you're going to be ambulatory and walking, and you're not going to be bedridden and confined. The other issue that we see that's very similar is the hammertoe deformity, where you find that your toes become bent or crooked at the joints. And I think that, again, depending on the type of problem that you have, alternative shoes, pads, gel pads, they all help you. But when it gets to the point where you want to wear your dress shoes to go to any festive activity or to go to a party, and you can't because your toes are killing you, then you probably have to look at some alternative there where you have them surgically straightened out so that you don't suffer from those problems. Both of these conditions are what I like to call quality of life conditions. What that means is how it affects the quality of your life depends on whether you want to do something. If you saw me today, I would probably tell you that if you came back to me in 5 or 10 years, I would still tell you the same thing. So it's just a matter of when you've had enough and you're no longer able to wear your shoes comfortably that you want to have something done.